My name is Pearline, and I belong to the Senior Caucus at Jane Addams. And I'm here because I have a deep concern and believe in the necessity of a Medicare for all.
So my name's Adam Gaffney. I'm the president of Physicians for a National Health Program. We're here today to take a stand against the American Medical Association's decision to oppose Medicare for All, to join a coalition of lobbying organizations that is dead set against Medicare for All, that includes pharmaceutical companies and insurance companies that are using their resources to prevent us from achieving universal health care in this country. My direct mission to the American Medical Association is to listen to the nation's doctors, step away from this opposition and join us in fighting for a real universal health care system.
Being a nurse and taking care of patients and seeing them denied health care, denied medicines because they can't afford it, working all their lives, losing their retirement to medical, it's not acceptable. We need Medicare for all, that they need to join us, that they need to get on with us. They need to quit taking their money from the pharmaceuticals and from the insurance industry, and they need to back and take care of their patients.
It always seems impossible until it is done. It always seems impossible until it is done. It always seems impossible until it is done.
My name is Sheila Sweeney. I co-founded a group called Northwest Indiana Medicare for All. I urge the AMA to change their stance and support Medicare for All. This is a matter of life and death, and a lot of my neighbors and friends are suffering from our for-profit system. So please change your stance and come with the people who are for this.
My name is Peter Gann, and I'm a member of the faculty at the UIC College of Medicine. My message for the AMA is to do the right thing. Back away from the Partnership for America's Healthcare Future and support the patients who desperately need affordable, high-quality health care.
Hi, my name is Larry Biondi. I'm not sure I got this, Larry. Tell me if it's okay. We need more help. We need single payer to get the help we need.
I'm Kristen Palick. I'm a doctor that graduated from Rush Medical College in Chicago. I started in Chicago because I supported single payer and because I supported the community.
My name is Phil Verhoeven. I'm with the Physicians for a National Health Program in the Illinois Single Payer Coalition, and I am here to say, AMA, get out of the way!
I stand before you today as a proud member of National Nurses United and in solidarity with every doctor, student, healthcare worker, and patient here today, along with the 70% of American people who support a universal, single-payer healthcare system in the form of Medicare for All. There are over 600 delegates from the American Medical Association meeting today in Chicago, debating whether or not they should drop their opposition to Medicare for All. I say, AMA, if you don't get on board today, then get out of the way.
Here to demonstrate my support for single-payer Medicare for All and for a national health program that covers everybody in the country. Well, the AMA has a new report out which is quite an advance for them, but it still defends and protects the private health insurance industry. I have no idea why, and it's time for them to give up on this private profit medicine and treat it as the social service it ought to be.
So I'm with the Students for a National Health Program. We're a group of medical students that support the Medicare for All legislation that is going forward because healthcare is an essential piece of the human existence.
I'm Glenda Monet, and I'm here today because my daughter was diagnosed with breast cancer at the age of 32. And has been through holy hell with the insurance companies to get the care that she has needed. She lost her breast. She had a horrible time getting it reconstructed. And it was all because of insurance companies being despicable. to a young woman who had a grade school-age child to raise.
We are here for those who cannot be here today. We are here for those who die, the tens of thousands who die every year for not having health insurance in this country. We are here for those who cannot afford their care. For the people, we have the richest country in the world, and yet 29 million people are still uninsured in this country. And even those who are insured have deductibles so high they cannot afford their medicine.
What we want health care for all. All. Not just for you, but for all people. Everyone sign with me. I want to live. Say it again. Point to yourself. Say, I want to live. Again. I want to live. That's time. I want to live.
Hey, Bill Honigman with Progressive Democrats America. I'm here to support Medicare for All. We're going to tell the American Medical Association that they're on the wrong side of history. They're not with us. They're not with the people. They're not with all the good doctors and healthcare providers out there who have to do the job and provide the healthcare to the people. The way to do that is to go with a single payer, expanded and improved Medicare for all. Get with it, AMA.
My name is Jennifer Epps Addison, and I have the honor of being the network president to 54 grassroots organizations in 34 states, Puerto Rico, and Washington, D.C. We're here today to say thank you. And I just want y'all to look next to the person next to you, and I want you to tell them thank you. Thank you for what you're doing. Because of all of you, because of your activism, we are already winning. This year, Medicare for All not only had the first hearing it has ever had, but will have 3 hearings, all because of your activism. My husband was diagnosed with multiple sclerosis 3 years ago. And through his illness, my family has seen that this current healthcare system not only doesn't work for no-income and low-income people, but it doesn't work for middle-class families who are struggling to get by either. And we have to fight with the insurance companies that we pay so very well just to get them to cover what we need. And where is this money going? It's going to the health insurance company executives and pharmaceutical CEOs who are profiting off the pain of our families. And that ain't right. It's going to hundreds of millions of dollars in costly administrative fees. And that ain't right. Medicare for All would allow millions of families like mine to stop making the hard choices between childcare and doctor's visits. It would allow us to stop weighing whether our medication or our food or our rent is a better investment to make that month. America is sick. This system is broken. And the only thing that will fix it is to remove the profiteering out of our care and to pass Medicare for All.
Silvia Sainz. Estoy aquí como una Westlake Warrior porque me descansaron del hospital. I'm one of the 7 Westlake Warriors that was laid off being a whistleblower for Westlake Hospital. With more than 23 years working with the community of color, I was able to connect with them. Something so simple as getting your blood pressure checked at all these health fair events. People were afraid to approach us because they didn't have health insurance. That's why I'm here with all of you, is to demand the American Medical Association supports all of our communities of color and all the races.
I'm here with my husband and my 2 kids because it's an example that we're showing to them that when something is not right, we fight back. 6 years ago, my community fought back against the storage of petroleum coke in our neighborhood. KCBX, a company owned and operated by the infamous Koch brothers, had 65-foot high piles of this toxic material. Fugitive dust coming from those piles was blowing all over our neighborhood. A public health crisis that united the community, and together we fought back until all those piles were removed.
after this rally, we are going to march to the Hyatt, where the AMA is meeting.
I don't want to practice healthcare in a system where not all my patients can afford it, can get the care that they need.
We're the richest nation on the planet and we can't even afford to take care of our own people. I think it's a disgrace. And yet we have enough money to spend on military intervention after military intervention. For what? For the profit of billionaires. That's got to stop.
I am a champion for Medicare for All. I am here standing up for myself. I'm standing up for my mom who died at a very young age. She died at the young age of 42 years old, aneurysm burst in her brain, a working class, part of the working poor. I'm standing up for her and mothers like her. I'm standing up for my son and future generations. AMA should support Medicare for All. It's unconscionable that they do not. They need to get out of the industry if they don't support Medicare for All. But I tell them one thing, nothing can beat or defeat a conscious-minded people on the move. And we are a conscious-minded people on the move. We will have Medicare for All.
My name is Dr. Sofia Marjanovic. I'm here with Center for Popular Democracy, protesting the AMA because we need Medicare for All. The Civic-Wise missing and murdered Indigenous women, and why I am here is because I'm Native American and I grew up all my life knowing that the Indian Health Service is where you go to die, and this is unacceptable.
I'm Matt Petty. I'm the Executive Director of Physicians for a National Health Program. I'm here because I believe healthcare is a human right. AMA needs to get out of the way.
Everybody in! Nobody out! Everybody in! Nobody out! And I'm from Amalgamated Transit Union. We represent CTA train operators. And we want all the medical to know that we're in full support of you, because if it's not for you, when we're injured, who's taking care of us?
My name is Lenny Brody. I'm with the Illinois Poor People's Campaign. We're fighting for Medicare for All and linking together all the injustices that poor people are facing in this country. It's poverty, it's health care, it's racism, it's environmental destruction, and it's militarism.
We are calling today for the AMA to drop its affiliation with the Partnership for America's Healthcare Future, to drop its opposition to Medicare for All, to join us in the fight for a real universal healthcare system. This is one of the most important issues of our time.
We were all out here marching and speaking. We had some brave souls who were doing a die-in in the convention, and I want to acknowledge one of the die-in participants, a member of Jane Addams Senior Caucus, Reggie Griffin. Everybody, let's give him some love.
Medicare for all. Medicare for all. Medicare for all. Medicare for all. With your help today, we came down to the AMA to let them know that they must get out of the way. And we did so by getting in their way today. We got in their faces.
Conflict of interest and
Support Medicare for all! AMA! Support Medicare for all! AMA! Support Medicare for all! AMA! Support Medicare for all!
We had at least 30 people that actually participated in the die-in. We even got some applause, okay? And I'm certain that's probably the rank and file.
We appreciate you taking the effort to discuss this. And I recommend that we temporarily recess the House.
Medicare for all! Medicare for all! Medicare for all!
But we brought it to them, and we're going to continue to bring it to them. The people have spoken, and we want what? Medicare for all!
Well, we had a great die-in. The AMA was kind of getting confused and scared that something might happen, and as the police negotiators talked and extended our time, we got some stories out.
My son Stephen was diagnosed with cancer of the tongue. Was diagnosed with cancer of the tongue. His financial
financial resources. His financial resources. Soon exhausted.
In my community, black and brown children are terrorized.
In my community, black and brown children are terrorized.
Because of rape, violence, and murder.
Because of rape, violence, and murder.
My whole life I struggled with post-traumatic stress syndrome.
I was part of the AMA Action Inside that took over the convention for about 20 minutes.
My name is Susan. I recently lost my health insurance.
Everyone was filming. People were happy to hear us saying that we were there to support all patients, and I think we're really moving the needle on getting things going within the AMA.
Take the time to thank all of the organizations who helped put this on. My organization, the best advocates advocating on behalf of their patients, Physicians for a National Health Program.
Everybody is in this fight, and nobody's out of this fight. We had die-in participants, but you know who got us here? You know who started this conversation? Medical students, the future of medicine.
My name is Rex Ty, and I'm the Midwest delegate for Students for a National Health Program. We represent a broad range of medical schools across Illinois, serving a wide diversity of patient populations in one of the largest, most demographically representative states in the country. But we all have a shared understanding that the current corporatized, profit above all health system is causing great harm to patients and healthcare workers alike, while lobbyists and executives get rich off of our suffering.
We are Bonnie and Drew, and we're medical students at the University of Chicago. We volunteer at free clinics on the South Side, where our primary patient populations comprise uninsured and underinsured children and immigrants.
We frequently deal with the incredible frustration of sending a patient away, knowing that it is unlikely that they will be able to successfully navigate the complexities and inequities within our current system to get the health care that they need.
Just across the river in Streeterville, a primarily affluent and white neighborhood, the life expectancy is 90 years. 9 miles away in Englewood, primarily African American and low income, the life expectancy is a full 30 years less. This is not an accident. This is a result of generations of racist and expletive policies that have resulted in this inequality.
This current system is disrupting the patient-physician relationship, and we've seen declining patient outcomes as a direct result of this. The sense of frustration and futility in caring for patients in a system that doesn't care about them is a major source of physician burnout.
We live in a world of abundance, not one of scarcity.
Right.
We make abundant resources scarce through privatization, by making it so only the wealthy few have access. My background's in public health, and my passion is in addressing health inequities. I know that for health justice, for racial and economic justice, for reproductive justice, for queer and trans liberation, all of it, we need radical solutions. Medicare for All is a part of that.
I want to shout out to the people who came here today. Because you could have been at the blues fest. You could have stayed home. You could have done anything else but come here and fight for something that is indeed a human right. You are on the right side of history. Your children, your grandchildren, the people in your community, the people that you interact will remember where you were today.
Hi, my name is Jordan. I'm the board president of Illinois Single Payer Coalition. I'm also a community mental health nurse in Chicago. I'm here today at the AMA rallies that we just had, and we were here today to tell the American Medical Association that it is time to get on the right side of history. It is time to start actually representing doctors, and it is time to start caring for all of your patients, not just some of them. And it is finally time for you to start supporting universal health care, Medicare for all.
Everybody in, nobody out.